All right. So hi, everybody. I am Carly Sage, functional integrative nutritionist, and I am here today with Dr. Keith Yimoyines. He is a naturopathic physician at TAO Vitality in Hebron, Connecticut. And Dr. Yimoyines has been practicing in Connecticut since 2011 after studying at the Southwest College of Naturopathic Medicine in Tempe, Arizona. His practice focuses on acute and chronic pain management, autoimmune disease, arthritis, digestive issues, allergies, and men's health. And he designs thorough individualized treatment plans for his patients based on the patient's goals, combining integrative healing modalities like nutrition and lifestyle modifications, detoxification, supplements and herbs, homeopathy, and acupuncture to support them in their path towards optimal health. But today we're really going to be focusing on the topic of Lyme disease with Dr. Yimoyines. And, you know, those of us in Connecticut here are very aware of Lyme disease and how it affects us, but it's really a growing topic that's affecting many people beyond the New England area. So it's been cited as the fastest growing epidemic in the United States and more prevalent than breast cancer by the CDC, actually. So that's pretty surprising. So welcome, Dr. Yimoyines. Thank you for joining us today.
No problem.
It's great to see you. And we would love to learn about really why you're so passionate about treating Lyme disease.
Yeah, so I got into Lyme disease when I joined TAO in 2013. And basically my passion for Lyme developed because I see people suffering from it. It's such a big problem. You know, now it's become a national problem, but especially in Connecticut and New England. And the people who have it and have been experiencing it for long periods of time, especially, they're being ignored by the conventional medical societies, basically. They've been to several doctors already. It's not uncommon for me to see somebody who I'm the 10th doctor they've seen, I'm the 20th doctor they've seen, and they've either been told, you don't have Lyme disease, you have some other autoimmune inflammatory condition, or they're kind of being pushed around, referred from specialist to specialist, the rheumatologist, the endocrinologist, the GI doctor, to try to, you know, solve those problems individually when the root cause of the issue is the infection and the inflammation that infection causes. So you see people suffer, you hear their stories, and we at TAO have found ways to really help those people. So it's gratifying work.
So would you say your work really evolved into this specialty area because seeing patients over and over again who really had some mystery illness, so to speak, and didn't get the proper diagnosis?
Yeah, and naturopathic medicine is perfectly suited in functional medicine, which is better, you know, well characterizes what I do. It's really well suited to the Lyme disease patient because they have such a wide ranging symptom picture. So Lyme affects every organ, every body system, can present as so many different things that you really have to take a holistic view of what you're dealing with.
So how do you feel like your approach and the approach used at TAO might be different than what other practitioners are using?
Right. So you have to recognize, yes, it's an infection. So Lyme disease is an infection, but you also have to understand that it comes along with so many other things. So you have the issue of co-infections. So you have Lyme rarely travels on its own. It's obviously a bacteria you get from a tick, but that tick is also going to carry some other things in it generally. So co-infections tend to be the rule, not the exception. So you have Babesia, Bartonella, mycoplasmas, all these different co-infections. People with Lyme generally have gut dysfunction, so leaky gut, which is either spurred on or exacerbated by food sensitivities. You see nutrient deficiencies in these patients because they could have some co-infection that's scavenging nutrients from them. They tend to have mold issues. So Connecticut's a very moldy place. So a lot of people live in old homes and they're breathing that in, and the mold's taking root, and that makes everything more complicated. And so you have all these issues rolled into one, and the approach has to be Yeah, you have to kill the infection. You have to get rid of the Lyme disease or whatever co-infections you're dealing with. But you also have to address all the other body systems, and you have to understand what should the patient be eating. What if the patient's not sleeping, how do you assist that? How are they managing their stress? What does their entire lifestyle look like? You have to really dig into everything they're dealing with, and our approach at Tao, that's what it seeks to do.
Yeah, very comprehensive. And
Hmm.
I mean, it's such a layered process, it sounds like, as with complicated, conditions. But how do you determine where to start with somebody when they first walk into your office?
Right. So a lot of people do come in. Well, we have a few different types of Lyme disease patients. So you have the patient who comes in and says, I think I have Lyme disease. I think I've had Lyme disease for a long time. And then you go through your kind of process of determining yes or no. Do they have Lyme disease? How long have they had it? You go through all your co-infection testing, your food sensitivities, your nutrient testing, testing for all the things we talked about. And then you also have people who come in with some nebulous inflammatory condition. They've been diagnosed with rheumatoid arthritis, although their lab testing doesn't look conclusive or may look conclusive. They might also have rheumatoid arthritis or Lyme disease brought on rheumatoid arthritis. And then you have the patient who has, no idea, I just don't feel well, what might be going on. And for all of them, you have to take this very comprehensive approach. So it's about dialing in, you can't just treat one symptom or one system, one organ, one disease, one diagnosis. You treat the whole person. So it's really about getting all the information up front that you need to come up with a real plan for solving their issue, and not just treating that infection, but treating all the other effects of the inflammation that Lyme brings on.
Right. That makes a lot of sense, of course, from a functional medicine perspective,
Hmm.
especially. What are some of the biggest obstacles that you might see in a treatment plan for somebody?
The biggest obstacles. So that's a really good question.
Mm.
I think the biggest obstacles are they tend to come when, well, one situation would be where you maybe miss something up front, where there's something that didn't quite show up in your laboratory testing, you're not entirely sure of, and then maybe a couple months later or a few months later the patient's not having the progress that you expect them to have, and you have to kind of go back to the drawing board. Other obstacles would be, really, we can give people some difficult dietary advice to follow,
Mm.
and it really has to be followed if you're going to get better in a timely manner. So compliance can be an issue on the dietary side. Stress is a big obstacle. So people are really stressed out, especially right now. I mean, everybody's stressed out currently, and we live in a very stressful world, and people aren't great at managing it. So you have to guide them through how to manage their stress, how to sleep properly. So everybody has different challenges that they face in their own lives that you have to address along with everything else. So
Mm.
those are definitely challenges.
Sounds like almost a total life
Yeah,
overhaul,
it
if you
very well
will,
can be. Yes, yes.
which I know is really daunting for some people, and it's a long process. It's not an overnight thing. So,
Yeah, you tell somebody you
yeah.
shouldn't eat gluten or have dairy or sugar or alcohol or soy or corn for the next year, and have to convince them that that's the proper path, and they're only going to get better. They're only going to get better in a timely manner if they actually follow all that advice, which can be very difficult for people.
Yeah.
And I get it. It's not
Hmm.
easy.
Right, right.
Yeah.
Yeah. I wanted to touch on something that you mentioned. You talked about co-infections, and
Hmm.
I think that's something that a lot of people simply aren't aware of. Um, can you talk a little bit more about that?
Right. So again, the tick will inject, the tick that bites you and gives you the Lyme disease will inject all sorts of nasty bacteria, viruses, and all that into you. So those are definite complicating factors. So you have Babesia, which is a common in the Northeast. It's in probably, well, actually the data from last year showed it was in about 13% of the ticks that they collected in Connecticut, whereas Lyme disease was in about 49%. That data came out last month. And so Babesia is a malaria-like parasite. It can cause a really nasty infection when you first get it, but most people don't even realize they have it. And if it comes along with Lyme disease, it causes similar but different symptoms to Lyme. So you have to be able to separate that out. Babesia causes more muscle aches than joint pain, night sweats, headaches, a particular type of headache in the back of the head. And then you have your Bartonella or cat scratch disease, which is carried by lice and potentially ticks. And that causes a lot of the mental emotional issues, anger, rage, depression, anxiety, weird rashes, also joint pains and different types of headaches. And you can also, Lyme can also reactivate certain viruses in your system. So Epstein-Barr virus is something that we test for. It's not technically a co-infection, but it can be reactivated by Lyme disease and cause more fatigue. We're also testing for mycoplasmas, Mycoplasma pneumoniae, rickettsia species like Rocky Mountain spotted fever, and they all, Anaplasma and Ehrlichia, there's the two I left off the list, or two of the ones I left off the list. So you're dealing with all these different bacteria and protozoa and viruses that essentially complicate the way that you diagnose the person, because unfortunately, some of the testing is not all that reliable for a lot of those things. And if you don't catch them early, it's hard to catch them on testing. So you have to look at what the patient's experiencing, what are their symptoms, what are the things that you can potentially say that it's most likely based on these markers and of what your immune system's doing, and these symptoms that, in addition to Lyme, you also have Babesia, Bartonella, and we should be attacking that as well.
Wow, it's pretty overwhelming to think about, that tick, having all of those things that they can possibly, they can hurt your health. And again, a lot of people just aren't aware of that. So aside from never going outside, and,
that's an option.
Which right now is, somewhat happening. What would you recommend to our listeners, just some preventative measures that they can take to avoid getting Lyme disease or a co-infection?
Yeah, so as I mentioned, in the data from last year, where the Connecticut Agricultural Experimental Station actually went out and collected about 2,500 ticks in the state of Connecticut, determined about 49% had Lyme, 13% Babesia, 9% Anaplasma. That's really concerning. So, and this was, I'm sorry, specifically deer ticks. They also collected dog ticks. I should have mentioned that. So those types of ticks, they rounded up and they tested, and those numbers just show you how big of a problem it is. So the only prevention for Lyme disease is vigilance and avoiding tick bites. So you just have to avoid wooded areas, avoid ticks like shade, you avoid long grasses, and make sure that your kids and your dog and animals are doing the same. Dogs can be a major issue, bringing them in and out of the house. Wear long pants, tuck them into your white socks, light covered, it looks ridiculous, but light colored clothing. You can spray yourself with tick repellents. There are some good natural ones in the market. It's made from cedar oil and lemongrass, and there's one called Wondercide that's very good. And then really rigorous checking of yourself every time, and your kids and your dog, every time you go out and encounter an area that could have ticks. So ticks like to hide in your hair, so look in those places. Skin folds, check all those places. strip down and throw your clothes in the hot, the washer on the hot cycle, or alternatively throw them in the dryer for 10 to 30 minutes on hot, and that should kill off all the ticks. So yeah, really vigilance with avoiding any sort of tick exposure. And the real concerning thing about kind of the conventional approach versus our approach when it comes to Lyme disease is the Centers for Disease Control says that a tick has to be attached for 36 hours to transmit Lyme disease. And that's just not true. Any amount of time that tick is attached to you gives you a non-zero chance of getting Lyme disease. So it could be as little as 10 minutes in that time frame that a tick could actually transmit Lyme and transmit everything else. And then tick removal is very important to do properly. So if you do find a tick on yourself, use tweezers to grab it as close to the mouth as possible, and don't grab the body, don't squeeze it, don't use alcohol or fire to stun it. It'll just freak the tick out and make it inject things into you. And now you can send off ticks for testing. So the state will do that. You can find instructions on the state website for their instructions on how to send them in. And there are also private companies that for a fee will test for more. So the state will test for Lyme disease, Babesia, and Anaplasma, but there's a website called Tick Report that I've used that will actually for a fee test for 20 different tick-borne illnesses. So you just have to be very, very careful. And I would advise if a tick is attached for any amount of time, testing of the tick itself and what the tick may contain would be appropriate.
Even if somebody is asymptomatic, they're not experiencing any common.
Yeah, because you don't know, you might have symptoms in a few days. So get that tick out. It takes a couple days for the test to come back. I think Tick Report is 48 hours. They'll send you an email. I'm not sure how long the state testing comes back off the top of my head, but yeah, even I would say before you become symptomatic, definitely send that tick off.
Yeah. So if somebody experiences symptoms, they get a tick bite, they should come in for an appointment. But let's say somebody has, as you mentioned, just these chronic ongoing amorphous symptoms that really they can't get any answers to.
Right.
What do you recommend they do in that case?
Yes, there's a different approach for a new infection versus a chronic Lyme disease, which is a complicated topic. But so for an acute infection, you want to do antibiotics. And we as naturopathic doctors in Connecticut can't prescribe antibiotics. So that would be a call to your primary care doctor or a walk-in clinic. And I would say, especially if you've saved the tick, gotten it tested, if you can bring it to them, they can have it tested, and you want to do antibiotics, and you want to make sure that it's a substantial course. Don't let them give you a single dose, which I think they stopped doing, but you want to do 21, 28 days of doxycycline unless there's some reason why you can't take doxycycline that your doctor will determine. And you would also want to there are also natural things that you can do to prevent that infection. So there are topicals, you can do topical echinacea, and there are also some herbs that you can take orally to boost your immune system to prevent the infection. Astragalus is a great one. And we have some protocols for initial tick bites that we do at our office. So definitely, give your primary care a call or go to the walk-in, get the antibiotics, and give us a call, and we'll have ideas as well to make sure that you're doing all the right things to prevent it from being chronic. And then in the people who, this is 2 years ago or 5 years ago or 10 years ago, then you get into, looking for all those things that we talked about before, establishing, what all the other co-infections and complications are of the infection. Testing at that point becomes trickier. I didn't mention testing in the acute case. That's also tricky because when you first get bitten, your body's not going to make an immune response for a couple weeks. So that's what we're testing for when we do Lyme testing. We're looking at your immune response. So that really, really complicates things at the beginning. So you have to be proactive. In the chronic form, testing is also tricky because the immune response is different in everybody. The test that we're using, the standard Western blot that has been used since 1994, unfortunately, and hasn't been improved upon, really doesn't catch, I would say, the majority of cases are missed just using that kind of standard testing. So, there are markers of the immune system. There's more fancy Lyme testing you do through a lab called IGeneX. There are other labs that do more comprehensive testing. And then, yeah, it's about nailing down what systems are affected by this. What are all the things that you can be doing to bring down inflammation in your body, get rid of that infection, boost the immune system or modify the immune system, and then all the lifestyle pieces we talked about earlier.
Mm-hmm. So if somebody suspects that they have had Lyme in the past, but they're still coming up being tested negative, what would you do in that case? What would you recommend? Just further testing that maybe they haven't had, some of the things you mentioned, or a different approach perhaps?
So a lot of times people will come to me with a Lyme test they've had, relatively recently, and by the CDC criteria, it's negative. So in order to be positive on a Western blot, you need to have a certain number of bands, and I will look at it. So their doctors told them it's negative. I will look at it and say, you probably do have Lyme because you have this band and this band, which are just your immune response to different proteins on the bacteria. So you're looking at a Western blot, even if it doesn't meet the CDC criteria, it may still ring as a positive to me because I understand which bands are the really important ones, the Lyme specific ones. And then if still unsure, then we can go on and do the IGeneX, do their Western blot, which includes more sensitive testing, includes all of the bands, which actually are not included in the standard Western blot that you get from a Quest or another kind of standard lab. You can look at what the immune system is doing, inflammatory markers, and from all that data, along with, at the end of the day, Lyme is a clinical diagnosis. You have to understand what the patient's experiencing and what could be tied into Lyme disease. And at the end of the day, you take all that information together and determine, is it worth treating? Or are you in a situation where it makes sense to pursue this? And that's, I'd say, it's tricky, but with an experienced practitioner, they'll be able to tell from everything you're experiencing and what your lab work looks like, whether you should be treated for Lyme disease or co-infections.
Yeah. Wow. So a lot of great information. Is there anything you want to leave the viewers with? Just some takeaways? Or anything else you want to add?
Takeaways. So I'll be in Natural Awakenings they're doing a March, April issue this year because of COVID. So I wrote an article about Lyme for Natural Awakenings. Okay. So look for that. And I just hope everybody stays safe through all this and is doing their social distancing and all of that. And yeah, it's going to be a rough spring for ticks. It didn't get all that cold this winter, so they're going to be out, and again, based on the data from last year, a good percentage of them will have Lyme and other tick-borne diseases. So keep yourself safe.
Yeah. So if for the people that are listening, if they want to make an appointment with you and become a new patient, they can go to taovitality.com. There's a new patient intake there. They can also call the office directly at 860-228-1287. And I guess that's it. Thank you for the wonderful information.
You are welcome. And one thing during these trying times, we are doing telemedicine, so we can see people, just like I'm talking to you, we can see people over the computer. So you don't actually have to come into the office. We are open, so as a courtesy, but we're encouraging people to do as much of the telemedicine as possible.
Yeah, thank you for bringing that up. That's a huge thing that is being offered right now that I think people can really benefit from. So they can see you from anywhere and not leave their house.
Yes.
Great. So,
okay.
Well, thank you so much.
Thank you for having me.
All right.